Welcome to this episode of Health Vision. Today, we are at the Information Technology Optimization in Healthcare Conference in San Juan, Puerto Rico. And we're going to soon be hearing from our experts on what they provide as far as information technology in healthcare and how their solutions are going to be changing in the rapidly changing healthcare field.
So we've seen a lot of changes over the years in healthcare. There's a lot of things that are happening right now that are really driving video technology within the healthcare. Some of those things are really the doctors themselves. They're needing specialists, people that can come in and talk or assess a patient over video, look at them, see what's going on. We also see things like right now there's a very big push on EMR, electronic medical records, and we find that video enables those the nurses and doctors to do that continued medical education. So there's a number of applications for, obviously for providing the healthcare. If a hospital didn't have a neurologist on staff 24/7, this enables them to be able to provide that service to those patients that come in, or they would never even see that patient because that patient would be brought to another facility instead of theirs because they don't have the capabilities to handle those. To have sign language. So for the people that are deaf, that can't hear, they have to be able to communicate to the doctor and the nurses in the room. The only way to do that is to have someone come into the hospital typically and do the sign language at the hospital. What we see is the ability to do that over video. And we've been using it with a number of different health facilities and providing that sign language to the hospitals so that the patient can get the proper care that they need. It's a great question. So yeah, there's again, if you look at things like sign language, if there's a number of hospitals, one is Lehigh Valley Hospital in Pennsylvania, that uses the sign language. And what they've seen is over a period of a few short years, they've increased the number of deaf people that come in, and so obviously that's drawing more of that population to them for the support that they need. A lot of neurologists that are on call 24 hours, 7 days a week, 365 days a year, and they're providing that far-end neurologist for those hospitals. So those patients can continue to go to those hospitals instead of bypassing that to the next. Sure. So we see Tandberg involved in the future of healthcare in many different aspects. One of them is within the ORs themselves, and being able to, a number of different hospitals provide teaching services. So they'll use the video to send that out, as they're doing operations or working on patients. More importantly is the ability for Tandberg to really take the technology out of the user's hands so they don't have to think of what they're really doing and just use it as a business tool like they would any other business tool that they're using. And that's going to be the ability, once we do that, to help drive this industry in the medical field and make it so that it becomes, video becomes just another business tool.